Welcome to Angel Health Academy. Subject Community Health Nursing. Topic for the day or topic for the session is Supervision Part 3. I have already uploaded Supervision Part 1 and Part 2 videos. This is the last video of Supervision, that is Supervision Part 3. As I have already mentioned, this is the third part of the video of Supervision. I have already uploaded Part 1A session of Supervision video and Part 1B session as the principles of supervision, a separate video, that is a mnemonic video of principles of supervision. Then Part 2, that is the second part of the video of supervision, and today is the Part 3. If you have not watched till Part 1A session, Part 1B session and Part 2 video, please watch that video first and you can join with the last part of the video of Part 3 of supervision. The Part 3 video is an important topic in community health nursing, that is supervisory responsibility of the community health nurse in PHC or primary health care. So there are three types of questions could be asked in university question paper, such as supervisory function of community health nurse in general, or supervisory function of community health nurse in primary health care unit, or supervisory function of community health nurse in primary health center. So let us start the topic, supervisory functions of community health nurse. Supervisory functions of community health nurse. The supervisory functions of a community health nurse can be classified into 8 different areas of supervision. So supervisory functions of a community health nurse can be categorized or classified into 8 different areas of supervision, such as the first one is administration at PHC, that is primary health center. Administration supervisory function at a primary health center. Second is observing, examining and reviewing the work schedule of the different subordinates or employees or workers. Observing, examining and reviewing the work schedule. The third supervisory function is maintaining the staff morale in the organization or in the institution. Maintaining the staff morale in the organization or in the institution. Then fourth area is supervision of field work of the subordinates or the staff or employees. Supervision of field work. Then fifth one is educational function. Fifth is educational function. And sixth one is personal evaluation. Evaluation of the subordinates, evaluation of the staff or evaluation of the employees. That is personal evaluation. Evaluation of the health personnel or health staff. Then supervision of students, both in primary health center, sub-center and even in field. Supervision of students. Then last one is, eighth one is maintenance of records and reports. Maintenance of various records and reports. So these are the 8 important supervisory area of the supervisory functions of a community health nurse. Let us discuss in detail about these 8 areas of supervisory functions of community health nurse. First is administration at PHC, primary health center. So administrative supervisory function at primary health center. This includes polish, P-O-L-I-S-H. I have been made a small mnemonic according to the supervisory functions at administration at PHC, such as planning, organizing, linking, that is connecting, implementing, supervising and helping the health personnel or workers. So P stands for planning, O stands for organizing various program at primary health center and sub-center. L stands for linking, connecting community health people to the medical officer. Then I stands for implementing various health programs or nursing care services. And S stands for supervising all the services or functions which is carried at a primary health center. Then last one is stands for helping the staff, that is polish. Let us discuss in detail about the supervisory functions of administration at a primary health center with these points of polish. So administrative functions at PHC includes the first one is planning, organizing, implementing and supervising the day-to-day assignments or activities at a primary health center. The first point is planning, organizing, implementing and supervising the day-to-day activities or day-to-day assignments at a primary health center. So first is under planning. The first supervisory function under planning is assigning the duties to health staffs or subordinates. Health workers or subordinates. So assigning the duties. Delegating the different duties according to the job description of the health personnel or delegates. Then planning work schedule. Second is planning work schedule of each and every subordinates or health workers. Planning work schedule of each and every subordinates. Then nursing administration, rendering nursing services, those who are attending, people attending in the or public attending at primary health center and sub-centers. So rendering quality nursing services at primary health center and sub-centers. Then fourth point is planning various community and family health services through the subordinates and health workers. The last point is planning various community and family health services through the subordinates and health workers. So these are the four important points comes under planning. Assigning the duties, planning the work schedules, nursing administration or rendering quality nursing care at PHC and sub-centers, then planning community and family health services. Second is organizing. It includes development of various policies, standing instructions for the subordinates or community health personnel or for the staff. So developing standing instructions, then various procedure manuals to render the community nursing procedures, comprehensive nursing procedures. The organizing function includes development of policies, rules and regulations, norms, then standing instructions. Standing instructions are the instructions where a community health nurse can do certain activities during the emergency when there is no medical assistance or when there is no physician. That is standing instruction. A special instruction to the community health nurse or health workers or subordinates to render in emergency situation. That is standing instructions. Then procedure manual is the book which consists a simple steps of procedure, different procedure that could be implemented or that could be done at PHC sub-centers or in the community field. So development of policies, standing instructions or standing orders, then procedure manuals, etc. Then next function under organizing comes ensure the adequate supplies and equipment at primary health center for rendering quality nursing services. So ensure adequate supplies and equipment to render the comprehensive and quality nursing, community health nursing services. The next function is establish effective methods of functions or methods of operation at both at primary health center, sub-center and even in the field. Establish effective scientific methods of activities or comprehensive nursing services. These are the 3 points, 3 functions under organizing. Development of policies, standing instructions, procedure manual, etc. Ensure adequate supplies and articles and equipment for rendering quality nursing services. And establish effective methods of operation, cooperative and good interpersonal relationship and good communication, thus to render the quality services. Then next point is linking. The next main function is linking or connecting. So linking is nothing but acting as a liaison. So under linking function, it includes coordination of care, that is coordination of all the care between the health personnel and medical officer, between the different type of health personnel, etc. So coordination of all the services, community health nursing services. Then act as a liaison between the nursing staff and the agency, that is medical officer and other health personnel. So liaison between the nursing staff, nursing personnel, that is the subordinates and the managers and medical officer and other health personnel. The next function is ensuring cooperation and involvement of various health related agency in rendering community health services. So ensuring cooperation and coordination between the various health related, other health related agencies and involving those health related agencies to render the comprehensive and promotive or integrative health services to the community. Other health related agencies are such as Education Department, Water Authority Department, Food and Agriculture, Road and Transportation, Communication and Broadcasting, etc. These are the other health related agencies. So ensuring cooperation and involvement of various other health related agencies to render the quality health nursing services. So under linking function, it includes coordination of care, act as a liaison between the nursing staff and the agency, that is medical officer and other health personnel. Then ensuring the cooperation and coordination and involvement of various other health related agencies to render the comprehensive and integrated health services. The next is implementing the various services. So implementing the work schedules. What are the work schedules are already planned to be implemented. So implementation of the various health services through the work schedules. Then nursing services at PHCs and sub-centers, rendering comprehensive nursing services to the public by the subordinates at PHCs and sub-centers. Then implementing planned community and family health services through the subordinates or other health personnel. Implementing various community and family health services which are already planned.
The next function is supervising. First is leadership.
That is leadership role. Lead the subordinates as a leader and maintain good leadership style and leadership power, such as the participatory leadership style, that is democratic leadership. Then periodical appraisal or monitoring of the community health nursing procedures which is rendered by the subordinates or other health personnel or employees. Then supervise the health clinics and camps and national health programs which is implemented through the primary health center and sub-centers. So supervise the conduct of the clinics like immunization clinic, antenatal clinic, postnatal clinic, under 5 clinics, non-communicable disease clinic, etc. So supervise all the activities in the clinics and camps, and then supervise various national health program which implemented in the primary health center and the sub centers. The last function under supervising is supervision of all the health workers and students who are who are posted in the primary health center or sub center to complete their requirement in the GNM program, B.Sc program and other JPHN program, that is student nurses and other health related other paramedical students. So supervision of health workers of both the staff and the students. The last supervisory function, that is helping. Under this helping is helps in identifying and resolving the health problems of the community. So here community health nurse as a supervisor who helps the subordinates or other health personnel to identify health status and various health related problems of the people or factors influencing the health of the community people. Then of course helps to resolving the various health problems of the problems in the community. Then second is helping the staff or health personnel or subordinates to solve both professional and personal problems through individual conference, group conference and various counseling sessions. So the last supervisory administrative functions at PHC is helping. That is helps the subordinate or other health personnel to identify the health related problems of the community and to help to resolve the health problems of the community. Then helping the staff or subordinates to solve their own personal and professional problems through various methods like individual conference, group conference and through counseling. So these are the different functions of the community health nurse as a supervisory administrative functions at a primary health center. The second area of supervisory functions of a community health nurse is observing, examining and reviewing the work schedule of the subordinates or health personnel both at the primary health center and in the field, who are working in the field. So observing, examining and reviewing the work schedule, periodical review of the work schedule. Time schedule and work schedule are useful for the orderly regulation of the activities or functions and for avoiding the omissions or repetition. So time schedule and work schedule are useful for the orderly or systematic regulation or control of the activities or rendering the quality activities, and thus for avoiding the omissions of some of the activities or avoiding the overlapping or repetition of the activities. The services include, first one is observing the work schedule of various grades or categories of health personnel. So first supervisory function under this, observing the work schedule of all the different grades of the health personnel or subordinates or health workers. Second function is examining and ensuring that, the daily schedule, weekly schedule and monthly schedule or list are implementing properly as it is planned. That is examining and ensuring or make sure that the daily list, weekly list and monthly list or monthly schedule are implementing in right time in a proper method. Then third supervisory function is periodical reviewing of this plan and schedule. Periodical review of the work plan or work schedule. Then fourth function is preparing and applying various checklists and evaluation format to evaluate the functions of the various health personnel or subordinates. Preparing and applying the various checklist or evaluation format or performance appraisal format for the evaluation purpose. Then fifth function is conducting periodic group discussion to give necessary suggestions for the improvement or for the correction or for the solving of various problems. So conducting periodic group discussion to give the suggestion to the subordinates or health personnel. So these are the 5 important functions which comes under observing, examining and reviewing the work schedule as a supervisory functions of the second category of functions of the community health nurse. The third supervisory function is maintaining the staff morale. maintaining the staff satisfaction or staff morale. First function is motivation of all the subordinates or employees and make the personnel feel that they are the important part of the organization or institution or the health center, and they are important for all the health programs which are rendered through the health center or through the institution. So motivation and makes the health workers, subordinates feel that they are also considered, they are also the important part of the institution by giving various opportunities to the health personnel or subordinates to decision making and planning, various health planning, and to implementation of all the programs. Then second function is maintain good personal or human relations. So that is maintaining good IPR, interpersonal relationship, and good rapport between or among the employees. That is maintaining good personal relations and human relations, good human relations through interpersonal relationship and good rapport. Then third function is conduct periodic conference, both group and individual, to solve the disputes or conflicts between the staffs or among the subordinates or the workers. So the third function is conduct periodic conferences, both individual and group conferences, to solve the dispute or problems or conflicts among the employees or subordinates. Then fourth one is conduct periodical staff welfare meeting for the welfare of the staff, for the development of the staff, development of the subordinates. Conduct periodical staff welfare or staff development meetings. The last function is give the workers a chance to keep in touch with each other problems and to air their grievances. So discuss the problems between the staff with all the presence of all the subordinates or staff. Let them understand the problems of each and every one and let them share their feelings and problems with others, like a team approach, and let them have a we feeling. So give the workers a chance or opportunity to keep in touch with the various problems they come across during their services, during their activities, or during their health services, and give them opportunity to relax and thus reduce their grievances or stress and tensions. Then make them more happy to participate with the we feeling by teamwork. So these are the 5 supervisory functions to maintain the staff morale in the organization or institution. Next is the 4th supervisory areas of a community health nurse in supervision, that is supervision of field work of all the employees or subordinates or health workers. That is supervision of field work of all the subordinates or other health personnel. It includes observation, supervisory home visiting, guidance, supervision of health personnel, and tools and techniques for supervision of staff. So it includes observation, supervisory home visiting, guidance, supervision of staff, and tools and techniques of supervision of staff. So let us discuss in short about the functions under supervision of field work. First one is observation. Here community health nurse observe the actual home visit of all the health personnel and the prescribed home visits. As per the institution policy or health center policy, each health worker has to do the prescribed or specific number of home visit in a month. So here community health nurse supervise the actual home visit which is done by the subordinates or these health personnel, and what is their prescribed home visiting according to the policies of the organization or institution or health centers. Health personnel include female health workers, auxiliary nurse midwives, female health assistants, lady health visitors, etc. So observation of actual home visit and prescribed home visits of female health workers, auxiliary nurse midwives, female health assistants, lady health visitors, other subordinates and other health personnel who comes under the supervision of this particular community health nurse. Second function is supervisory home visiting, doing supervisory home visiting. So observation of a technique of home visiting of the subordinates or the health personnel during our supervisory home visiting, supervising the family nursing services provided through the home visit by the health personnel or subordinates. So supervising the family nursing services that is rendered by the various health personnel during their home visiting. Then evaluate the achievements of home visit which has been done by different subordinates or health personnel. Evaluate the achievements of the home visit that is made by the health personnel or subordinates. So that is about the supervisory home visiting, observation of technique of home visiting all the subordinates or health personnel, supervising the family health nursing services that is provided or rendered by the subordinates or health personnel during our visit. Then evaluate the what are the achievements that has been done by the various health personnel or subordinates during their home visit. And third main function is give guidance for home visiting. So during her supervisory home visiting, if anything is needed, she will guide the health personnel or subordinates during their home visiting to render the comprehensive health services to the community or public. That is give guidance for home visiting if necessary for the subordinates or health personnel. Then fourth function is supervision of all nursing personnel at work, both in health center and in the field. So supervision of all nursing personnel at work, that is supervision of all subordinates who comes under her supervision. The first function is selection and recruitment of the various staff, health workers, community volunteers, etc. That is selection and recruitment. That is participation in selection and recruitment. Facilitate the staff performance. Facilitate the staff performance or promote the performance of each staff. Help the staff to render the comprehensive health care and help the staff to update their knowledge and skill through motivation, counseling, guidance, etc. Thus render the quality nursing services. That is facilitate the staff performance. Then home visiting with the staff. So home visiting with the various staff as part of the supervisory home visiting and give necessary guidance if necessary. The next one is observation of activities at various clinics and camps. That is observation of the various services or activities of the subordinates or health personnel at various clinics and camps conducted at primary health center, sub-centers or even in specific community. The last one is supervision of staff in school health program, other community health services and occupational health services or factory health services or industry nursing services, etc. So supervision of staff in school health program or school health services, supervision of staff in rendering various community programs in the community, and supervision of staff who do the occupational health nursing or factory nursing or industrial nursing, etc. So these are the important functions under supervision of all nursing personnel at work, both in health centers and in the field. The fifth function is tools and techniques of supervision of various staff. I have already explained in detail about the various tools and techniques of supervision in the part 1 supervision video. If you have not seen, you can go through that and you can watch that particular video. Here I am just discussing about some of the important tools and techniques which is used by the community health nurse for the supervision of the staff. I have not included all the tools and techniques. So for an in-depth knowledge of the tools and techniques, you can watch the supervision part 1 video. So here tools and techniques of supervision of staff include participation, individual and group conference, anecdotal record and other various tools and techniques. The first tool and techniques of supervision of staff is participation. So as a part of the supervision of the staff, community health nurse participate in planning the health services, planning health programs, planning the work schedule and duty list, duty roster, etc. Then participation in various policy making in relation to render the quality services. So participation in policy making, and moreover participation in various community teaching or community health education program or health awareness program or IEC programs. So participation in planning, policy making and community teaching program. Through this participation, community health nurse is able to supervise the activities and functions of the subordinates or health personnel. Second is conducting various individual and group conference with the subordinates and other health personnel. So that is the conducting individual and group conference. Individual and group conference or meeting with the health personnel or subordinates. Then third is anecdotal record. That is supervising the anecdotal record of the various health personnel or subordinates. So all the incidents of the subordinates will be recorded in a specific anecdotal record. Their behavior, their activities, what they have been rendered during that particular incidents were recorded in the anecdotal record. So community health nurse can supervise the or go through the anecdotal record of the each and every subordinates or health personnel to get the adequate information about that particular staff. Thus anecdotal record is the one of the tool to supervise the staff by the community health nurse. Then fourth one is others. There are many tools and techniques to supervise the staff both in the health center and in the field could be used by the community health nurse, such as various records, various reports, checklist, rating scales, evaluation formats, then performance appraisal formats, etc. So these are the four important tools and technique of supervision of staff by the community health nurse as a part of her supervisory function. The next area of supervisory function of a community health nurse is educational function. That is fifth area is educational functions. The first function is conducting orientation program for the newly appointed health personnel or subordinates. Conducting orientation and induction programs to newly appointed staffs or subordinates. So conducting orientation programs, organizing orientation programs. Second one is organization of staff development programs, staff welfare programs and various other healthcare and health development programs. So organization of staff development program for the upliftment of the staff, staff welfare program, then staff health care programs, etc. Then third one is arranging various in-service education or in-service training program for the health personnel or nursing personnel employed in the health center or those who comes under her supervision. So arranging of in-service training program or in-service education program to the staff or the subordinates. Then fourth one is motivating and arranging for continuing nursing education program to uplift the professional growth of the subordinates or other health personnel. So motivating the health personnel or subordinates to go for the higher education as a continuing education program or arranging for the participation of continuing nursing education program of the subordinates. So these are the four important functions which comes under educational functions. Conducting orientation program, organizing staff development program or staff welfare and staff healthcare program, arranging in-service training program or education program, and motivating and arranging for continuing nursing education program for the subordinates or the staff who comes under her supervision. The sixth area of supervision is personal evaluation or evaluation of the staff or subordinates. First is appraisal and appreciation. Appraisal means monitoring, periodical monitoring of the subordinates, and appreciation means positively motivating and encouraging the staff to do the more effective and quality rendered services. So appreciation means positively promoting and motivating the health personnel to do more effective and quality rendered services. So appraisal and appreciation. Second one is periodical evaluation of the health personnel or subordinates. It includes formative and summative evaluation. Formative evaluation is nothing but here evaluation is done during the services which is rendered by the health personnel or subordinates. Summative evaluation is done at the end of the program or at the end of the activities or services to check the quality output of the that services or result of the services. That comes under summative evaluation. So periodic evaluation includes a formative and a summative evaluation of the staff or health personnel or subordinates. Then third one is comparing the job chart and the actual work has been done by the various health personnel or subordinates. Comparing the job chart, according to the job chart, it has been prescribed their specified role of each health worker or subordinates. That could be compared with the actual work what they have been done during that period. Then evaluating the achievements of each workers or subordinates in the area of RCH and family planning, that is reproductive health, child and family planning services, control of various communicable diseases and other non-communicable diseases, implementation of various national health programs, and research and epidemiological aspect of or conduct of epidemiological survey in the community or in the field. So that comes under evaluating the various achievements made by the subordinates or health workers in the field of RCH and family planning, communicable disease and non-communicable disease control and prevention, implementation of national health program and research activities, and epidemiological surveillance for the early detection and control of the diseases. The next is preparing various checklists for evaluation of the personnel, that is preparing the checklist. Then sending reports and recommendation of the subordinates regarding their achievement, failures of various subordinates or health workers. That is sending the reports and recommendation to higher authority regarding the achievements and regarding the failures of the subordinates or health workers. Then self-evaluation, that is analyze own performance periodically. So supervisor has to analyze his or her own performance periodically, that is self-evaluation. Then prepare and submit the monthly report to the medical officer. Prepare and submit the monthly report of her supervision to the medical officer. Then evaluate both the clinical and field services that is done by the subordinates and other health personnel. So that is evaluation of both the clinical services that is at the health center and field services in the community by the subordinates. So evaluate both the clinical and field services done by the subordinates. The last one is review the attendance in the health center, such as new registration that is done by the antenatal registration, infant registration, etc. Then revisits done by the antenatal visit, postnatal visit, etc. That comes under revisits. The number of immunization covered or percentage of immunization covered in under 5. The number of family planning methods or measures adopted by the eligible couples, that is temporary and permanent method of vasectomy and tubectomy sterilization. The number of delivery conducted both at the center or health center and at home. At home as a domiciliary midwifery. So number of delivery conducted in the health center, that is primary health center, and at home, etc. So these are the attendance has to be reviewed periodically by the community health nurse as a supervisory function. So these are the important functions under evaluation of the staff. The seventh supervisory function of the community health nurse is supervision of students. Supervision of students. So community health nurse has to participate in various student training programs. So participation in student training programs such as field experience for the GNM students, general nursing and midwifery students, B.Sc nursing students, then other students, paramedical students or students who are studying about the junior public health nurse, health worker male, health worker female course, etc. Thus the community health nurse has to participate as a supervisory function. She has to participate in all student training programs. Then second is checking the clinical diary of the nursing students, that is daily diary of the nursing students. Then giving the daily assignments to the nursing students, daily assignments to students. Then fourth function is cross-checking the documentation or record which has been done by the students as a part of the field experience, as a part of the posting in the health centers. Then assessing the various skills of the nursing students in doing procedures, that is rendering various nursing procedures with the back technique. Then community health nurse also vigilance in general cleanliness of the neat and tidiness of the uniform of the students, then their attitude, positive attitudes, then the interest and knowledge of the students. Thus community health nurse has to make a keen observation in the cleanliness of the student, attitude, interest and knowledge of the students. Then seventh function is tools and techniques of supervision of the nursing students. So tools and technique for supervision for the student nurses. It includes the initial conference, conducting the conference at the beginning with the orientation program to the students on the first day of the PHC or sub-center visit or posting. So initial conference. Then second tool and technique is assistance or helping the students to render the services to the client. That is assistance with the client side or with the patient side or the family member side. So it is assisting or helping the students to render the community health nursing services to the client or a family member. Third one is supervision of nursing procedures. So supervision of various nursing procedures that is rendered by the student nurses through back technique. That is supervision of various nursing procedures rendered by the student nurses through back technique. Then conducting periodic conference, individual and group conference. Then reassurance, that is nothing but motivation of the students to render the quality nursing services, thus increasing the confidence of the student. The sixth tool and technique is maintaining anecdotal record of each and every student, that is maintaining anecdotal record. Then seventh one is incidental teaching as a method of supervision. So another tool and technique of student supervision is incidental teachings. The opportunity is giving to the student to have a incidental teaching depend upon the various condition or new condition in the clinic and in the clinical setting and the family. That is incidental teaching. That means during the home visit when there is a new incident in the family member, giving opportunity to the students to conduct an incidental teaching or health education to the family member and supervising that incidental teaching as a method of supervision. Then eighth one is answering and asking the question to the nursing students, answering or clarifying the doubts of the students and then asking questions in relation to the new cases which has been seen during the home visiting or in the health center. The ninth one is demonstration of desirable performances. So demonstrating various procedures and getting the demonstration from the student nurse. Then 10th one is positive suggestions, giving positive suggestions and instruction to the students and getting positive suggestion and healthy suggestion from the student, that is positive suggestions. Then making an opportunity for observation of unusual symptoms or new cases both in health center and in the community during the home visiting. So that is making an opportunity or a new platform for the students to observe the unusual or new cases or new outbreak or diseases at the center and both in the center and both in the community during the home visiting. So these are the 11 important tools and technique for supervision of the student nurses by the community health nurse in her supervision. So these are some of the supervisory functions of the community health nurse in relation to supervision of students. So the last or eighth supervisory function of a community health nurse is maintenance of records and reports. Maintenance of various records and reports in the health centers. So first is collected and maintained all records at sub-centers and primary health centers. So she has to collect all the records that belongs to sub-center and primary health center. Then it has to be periodically maintained all the records and reports at sub-centers and primary health center. That is collection and maintenance of all records at sub-centers and primary health center where she belongs. Then second is making necessary corrections in the records and reports which is maintained by the subordinates or the health personnel and giving proper guidance to the health personnel or subordinates to maintain the record properly. Then examining the reporting system of all the staff or the subordinates. There are various reports in the health centers to be prepared and submitted by the health personnel. So examining the reporting system of the various staff or subordinates who comes under community health nurse supervision. Then forwarding the reports if necessary to the medical officer, such as a monthly report, etc. Then forwarding the reports to the medical officer or other health authority if necessary. The last important function of a community health nurse in relation to maintenance of record is record supervision. That is supervision of various records. Let us see what are the functions comes under record supervision. Record supervision is another important functions of the community health nurse, which helps to maintain all the records, reports, registers, etc. And that will ensure its future utility and utilization of the records and reports for a long period. That includes a routine review or periodical review of all the records and reports. Then routine review under record supervision, it is a systematic scanning of both outside, inside and specific sheets of each record. So routine or periodical review of the records and reports under record supervision, it is a systematic scanning examination of the both outside, inside and specific each single sheet of each record. So it is a systematic scanning of outside, inside and specific sheet of all the record, which helps or which reduces the repeated common errors which occurs during the documentation of various records and reports. Thus it reduces the repeated common errors in the records. Then it also includes the self-review of the on record, which is maintained by or recorded by or documented by the community health nurse herself. That means routine review of the records, various records and reports includes routine review of the records which is maintained by the subordinates and other health personnel, and record and reports which is maintained by the community health nurse herself. Then record supervision also includes a scrutiny of various records. That is a systematic examination of the records on the commencement, when it is started, when it is closed. Then scrutiny about the type of the case attended in the primary health center or in the community during the home visiting. And type and content of the services, different type of services rendered, etc. All has to be scrutinized under record supervision. So this is about the supervisory functions of the community health nurse in primary health center or in primary health care. So thanks for watching. So far we have discussed about the supervisory responsibility of the community health nurse in primary health center or primary health care level. So this is the third part of the video of supervision. With this we have completed the complete content of the supervision. I have already uploaded the first part, second part, and this is the third part. Hope this video really benefits in your studies and exams. If you feel it is really worth and benefit, please like, share and subscribe my channel. Once again, please don't forget to subscribe my channel and stay tuned with Angel Health Academy for the next and important educational video. Thank you.